topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, Dallas-Fort Worth. Welcome to another Ask the Expert show where we bring you the top experts in the field of legal, health, financial, and home improvement. I have been doing the Ask the Expert show for 15 years. Up until about a year ago, I never had a show on neuropathy. And I got to tell you, since we started this show, we have had more doctors around the country just because of the neuropathy treatment show we do here in Dallas-Fort Worth. We've had more doctors contact us wanting to do a neuropathy show in other states across the country. I never realized how important a topic like this is, and maybe because we didn't know enough about it. But our expert today with us, Dr. Tim Uselton, he really got deep into neuropathy treatment. Good morning, Tim.
Good morning, Steve. How are you doing today?
Bro, I got to tell you, this has just blown my mind how important a topic neuropathy is, and that how many people suffer from neuropathy, and you've kind of now dedicated your practice to neuropathy.
That's right, Steve. You know, it does affect about 40 to 50% of people over the age of 65. So 1 out of 2 people are dealing with some sort of feelings of numbness or tingling. I started seeing that trend. A lot of medications that people are on long-term actually cause this. A very big one would be diabetes, obviously, and the medications that prescribed with diabetes can sometimes lend to more neuropathy symptoms. Also, high cholesterol meds like the statin drugs that people take for long periods of time can cause some peripheral neuropathy symptoms. And there was no real good answer. And so back in 2018, I buckled down and I got my board certification in neuropathy, and I discovered, the causes of it. Chemo-induced after cancer treatment. Chemo is very harmful to the nerves, so it causes the blood flow to decrease to those nerves and they start to die off. So it is very common, and 1 out of 2 people walking around are dealing with some sort of symptoms. And then, the treatment up until now has just been hit or miss. It's been at best, something that kind of suppresses the symptom, but it doesn't really fix the lack of blood flow to the nerves. So, people get on drugs like gabapentin or Neurontin. It's very common, and it's very addicting. You got to titrate if you want to get off of it, so you can't just stop it. But people that advance all the way to the point of having their toes amputated, which is the very last resort, end stage of peripheral neuropathy, those people are still taking gabapentin at the time of surgery. So gabapentin doesn't fix the problem. That's what I learned. And so now I'm just here to share and let people know what they can do to catch it in advance. Advanced catching of it is the key. If it's too far gone, then it's gone. You're getting your toes amputated. But if you catch it early, when you first start to get those symptoms of numbness or tingling, then we can really do lots to turn that around and really change it and actually reverse those changes.
I wonder, we talked about our last show that Deion Sanders had a few of his toes amputated. And I wondered if he had neuropathy.
He did. He actually had complications from neuropathy and from turf toe, but he has been a diabetic, and diabetes is a disease that spikes your blood sugars. When your blood sugars spike, When you eat the wrong thing and don't get the proper insulin to counteract that, then that spike in blood sugar floods your body with inflammation, and it goes to the furthest part away from your heart in the blood flow, in the vessels. And so that is the toes. Basically, that's the furthest point from your heart. The longest arteries go down to your toes, and that's where it starts. And so it's true that he did suffer. Now, I've heard reports that he lost a toe, and I've heard other reports that he went back a few years later and lost another toe or two. I
Yes,
don't know.
that's what I heard.
He hasn't really opened up and said this, that, or the other, but I know that he has walked with a limp. I've seen him. During his playing career, he missed significant time with turf toe, which damages
Yes.
blood vessels. So he had kind of the combination of that affecting him. But yeah, he's one of the more well-known folks that has actually gone to the point of having an amputation, I do believe.
Yeah, especially in Dallas. Tim, I got to tell you, I am surprised from letters that we have received. You're a doctor of chiropractic.
Mhm.
I'm surprised a lot of the MDs have not had the kind of success that you've had with neuropathy. Does that surprise you at all?
At first it did, but now that I know more about it, it doesn't surprise me. And the reason is that, we as doctors do what we're trained to do. And the general PCP, the primary care physicians, they're trained to medicate. They have a list of symptoms. They know a drug that counteracts those symptoms. They aren't really fixing the problem. And most would admit that, but they don't have any other choice. That is their choice. If they're a surgeon, then they wait till you get bad enough to cut your toes off. If they're a PCP, they get you on a medication that will push it out further. Won't ever fix the problem. And so when you understand that peripheral neuropathy is really a blood flow issue into the nerves die because the blood is not bringing them oxygen and nutrition. And the nerves are coated with a myelin sheath, which is actually made out of cholesterol, by the way. It's a fatty substance that helps the electricity of the nerves go through the flow of nervous information. And so when the outside of that nerve that's supplied by blood flow starts to deteriorate and break down, it exposes then this myelin sheath that starts to break apart. And then you get raw nerve that, causes all kinds of crazy electrical type symptoms to the brain. And you say, wow, one day it's numb, one day it's cold, one day it's hot. Maybe in the same day, it's cold, hot, numb, and on fire, or tingling, like it's falling asleep, pins and needles, or you creepy crawlies are walking around on your feet. All of those are symptoms that tells your brain something is off. The myelin sheath has been broken down, and now that nerve has been exposed. When it's exposed, it's nothing more than an extension cord that you see the insulation that's broken, and you see the copper wire inside the wire that's running into your garage outlet, and you go grab it, and it shocks you. That's just saying, hey, there's no covering around this, and it doesn't know exactly what it's going to do. It's going to shock you. Same thing happens in our feet. There's no covering around it, and then it starts to shock you. The answer is not to just suppress the symptoms getting to the brain. The answer is to increase the blood flow, because blood flow brings oxygen and nutrition back into bad tissue, and then it wakes it back up. It brings it back to life. It actually restores the nerve function. And so that's what we're all about. We're trying to figure out ways every day to increase blood flow to these patients. And if it means getting off of a med that's causing it, we encourage them to get with their doctor and get off that med. If it's lack of movement, then we put really good movement in there. If there's other things that I like to talk about today, as far as how we regenerate new tissue. Here in the office, we've started doing some regenerative medicine types of treatments, and they work remarkably well. They've shortened the curve of it being such a long, drawn out process to bring in blood flow. Now we can get it going in days and weeks and months in some people. So we do regenerative medicine in the clinic now. It really jumpstarts the body's ability to heal itself. And just a small portion on that, I won't talk too long here, but when we're born, we have the most amount of regenerating cells we're ever going to have in our body. If you think about the birthing process, it started with fertilization of an egg, and then 9 months later, that single cell organism, that's one fertilized egg, one cell, has turned into over 80 trillion cells in 9 months.
Wow.
So the human body has at birth 80 trillion cells, it's estimated. Never again in our entire life, if we live to be 100 or 120 even, are we going to experience that much growth and multiplication of cells over a short 9-month period. And so when you think about it, when you come out of the womb, you have all of these cells that are just supercharged, on fire. And then as you age, by the time you're 18 years of age, you're not even skeletally mature yet. You haven't gone to college, right? Haven't voted. You've lost half of those regenerating cells. By the time you're 65, you're lucky if you have 5% of them left. So that's why we don't heal when we're 65 like we did when we were a teenager. So those cells, we have the ability now to take some of those cells out of an elderly person and concentrate those cells and bring them back to a level of viability, maybe like when they were 30 or 40 years old, maybe not, like when they were born, because it's hard to get those back to that level. But we can take those out, concentrate them, and put them back into the areas where the nerves have died, and it'll bring in that new blood flow. It really, really works well. They're called regenerative medicine for a reason. They regenerate new tissues, which includes nerves and blood supply. Now, if you want to go back to the day old cells, we can actually buy those from tissue banks. They come to our office frozen, and we put those into the body as well. They do great for rebuilding nerves down in the lower extremities. So that's a kind of a conversation that we haven't really had on this broadcast over the last several months. We talk a lot about the other things, but we're seeing really, really good results in the regenerative medicine arena.
Well, to show you the popularity of your show, look over here in the chat line list. We've got a lot of people writing in. Ben wants to know, will shockwave therapy help the legs after chemo?
Absolutely. Shockwave therapy is one of the quickest ways to get a flood of blood flow. Now, there are some contraindications, so it's not for everyone. If you're on blood thinners, if you have a history of clots, you don't want to maximize that shocking of the tissue to get blood flow. But shockwave is also known as acoustic wave therapy. It's a sound wave technology. It's where we kind of, like if you had kidney stones and they're too big to pass, then at the hospital they'll do lithotripsy and they'll blast you. They call it, you got 10,000 stone blasts or whatever, and it'll break it into smaller pieces and then you can pass it. Well, all that's doing is it's sending a sound wave into the body to break up that calcium in the kidneys. Well, this sound wave technology we use is on the same spectrum, but it's not as strong. So it's not going to break calcium down. It's going to just cause the tissue to say, I need blood flow. I need blood flow. And it actually creates new and additional blood flow. That's why, those shockwave treatments are beneficial to like for men's health, for treating ED, erectile dysfunction. That's a blood flow issue. And so they use the shockwave in and around on the male health side, and that helps with blood flow. We know that happens. I mean, people reduce their erectile dysfunction, in a matter of 2 or 3, 4 treatments. But when we do it on the bottoms of the feet, on the ankles, on the calf muscles, it just demands blood flow to come into the area. So that's one of the ways that we treat it. And we use a very thorough approach. We're not just going to do one or the other. We're going to, if you're a severe neuropathy patient, we're going to do all that we can do. We're going to change your nutrition. We're going to get you on red light therapy. We're going to get you a vibe plate to use at home. We're going to get some stimulation going. We have ultrasound. We have infrared here in the office. We do manual work on the feet. So it's a very all-inclusive. The really difficult case is if you do 1 or 2 things, you see little bitty tiny improvements. But if you do it all, you'll see 30, 40, 50% improvement.
Henry wants to know, does the red laser light treatment help the legs and feet?
Exactly. That I just mentioned that the red light is very, very beneficial. There are probably more white paper studies done and posted in PubMed.gov than many other studies on medications, actually. I mean, there are reports all over the place of these thousands of people and these thousands of people, and one got red light and one got a fake red light, or they got a visible red light and they got the red light with the infrared wavelength. And those things matter, because when you buy any old red light wrap or something off of Amazon, it may not penetrate the skin. Like if you don't have the right specifications of the light, it comes in wavelengths. So you got to have at least 880 nanometers of wavelength, the length of the wave itself, in order to penetrate the skin and get to the nerves and blood flow. So it can be very beneficial. It can also be a waste of your time and effort because you do it and nothing happens, and you find out it's not the right laser to penetrate. Some lasers are used for like skin conditions like acne or scarring, and they're not designed to penetrate, but you need to penetrate if you're going to try and fix the nerves inside. Great question.
We just got a text from Tanya in San Antonio. Dr. Tim, I found your show 4 months ago and I really enjoy it. I've been under a chiropractic care for 5 years. I am moving to the Dallas Fort Worth area. What other areas besides neuropathy do you treat?
Oh, great question. I appreciate it too. So we got board certified in neuropathy in 2018. And with that came a chronic pain management board certification. But our board certification in the chronic pain side is a drug-free, surgery-free approach. So that enabled us to help fix low back discs and neck discs. So we have non-surgical spinal decompression therapy. We address inflammation all over the body with IV nutrition. So we'll start an IV and we'll put in the good B vitamins, vitamin C, glutathione, super antioxidants, and we'll get people better and decrease their inflammation that way. In some cases, that lowers people's A1C. It lowers their APL, all the different enzymes around the heart and liver, the C-reactive proteins that are causing all of these symptoms. We'll actually lower them with good proper nutrition. We have what else? I already mentioned the shockwave, the infrared, the combined electrochemical therapy specifically for the neuropathy. We have some very good medically supervised weight loss programs, and so we kind of have become more of a wellness center where you can get many things addressed, not just neuropathy. That's one of our big three, probably, with the other two being the rehab and the disc decompression, and then the IV therapies.
Okay, let's go. There's a question here. Francis wants to know, what does this process involve? I guess she means the process of neuropathy.
Okay. So the process of neuropathy is that we would start with a neurological evaluation. We would see the percentage of sensory nerve loss that you've suffered. If it's your feet, most commonly it is. We would check the feet bilaterally, and then we'd check them as they go up the leg, because typically it starts in the most distal, the furthest away part, like toes or bottoms of toes or pad of foot. And then we check it as it goes into the top of the foot, into the ankle, and up into the calf. Some people have neuropathy from mid-thigh down, and it's really progressed. But we would need to check that out and see how far yours has progressed, to be able to tell you then the recommendations for the treatment, because someone who's got a neuropathy from mid-thigh all the way down versus someone that's got one part of their foot is very different. But the treatments, we do twofold. One is we have an at-home program, a protocol that's done 100% from home. We give the patients all of the instructions and the equipment to use some of these things at home, and then a lot of nutrition, because we want their nutrition right. We want to decrease their inflammation. We want to give them vasodilators. We want to give them things that really help bring the blood flow in and decrease the body's inflammation. And you can do that through the gut with proper nutrition. So that's an at-home thing as well. The B side of that would be people that are close enough here to come into the office and get on one of our biggest machines. It's called a Synexus machine. It's a neogen where it generates that new nervous tissue. So it kind of looks like an electrical modality but it's got some big suction cups that we place around the feet, and then we inject some chemicals, meaning mainly B vitamins, B1, B6, B12, and some other things to make it not so acidic. And we put that into the nerves in the area, right into the foot. And then we hook the machine up, and the machine draws these B vitamins and the lidocaine. And that's why it's called combined electrochemical therapy. The electro is the machine. The chemical is the injections of these vitamins in a special concoction. And then that really, really does help increase. But that's kind of a treatment that you need to do 20, 30, 40 times, depending on the severity. And that's done in the office. So it may be a person on a treatment plan for 4 to 6 months. And then we're doing some nutrition at home. We're getting them a red light to use at home. We're doing all those things as well. But yeah, you can do it at home if you're remote, like you can't get to Dallas. You say you live in San Antonio. We can ship it all to you. Yep.
We just got a text from Corsicana.
Okay.
A doctor in Corsicana wants to know, do you get many referrals from doctors?
Absolutely. In fact, over the last couple of years, our target has been actually going out and spreading the word. You call it marketing, call it whatever you want to call it, but we're going into the general, the MDs, the DOs, the PCPs around our office, and we're flooded in this area with probably 30 or 40 PCPs right here within 2-3 miles. And we drop off things showing what we do, because they're all scratching their head going, yeah, this neuropathy is not getting better with gabapentin. And they really, if they're a good doctor, they want to really help their patients. And then we just have to educate them, because typically these treatments that fix the nerves the best are not covered by insurance. And so the PCP, they live off of insurance. They can't comprehend a treatment that's not covered by Blue Cross. And so they don't offer it in their office. They would never offer this type of thing, because their model is get in and out in less than 4 minutes, do high volume, and write a lot of prescriptions. That's how they make money. And again, back to where I started, it's not their fault. It's how they've been trained and taught. And so they are doing what they're taught. We have a few that break out of that model, and then all of a sudden they start doing regenerative medicine. And those are the ones that are very well read and whatever. But we definitely get a lot of referrals from MDs around here. And it's people that typically have neuropathy. They have chemo-induced neuropathy. They have out-of-control diabetes. And we start helping them on the nutrition side as well as the other. And all of a sudden, next thing you know, they're getting off their metformin because their sugars are coming down, and they're not needing all the other things that they're on if they're type 2 diabetics. So it's a great question, and yeah, I appreciate it.
Greg in Grapevine wants to know, what areas of pain management do you cover?
Okay, so we primarily work on joint pain, and the most common is like knee pain. Sometimes we get hips and shoulders as well. And of course the spine, neck, upper back, lower back, all those areas of chronic pain. We have kind of a similar approach. We go at the structure, and then we go at the metabolic health, and then we go at the nervous system. And so if we can determine which of those are the biggest factors, that'll determine how it is we're going to treat them. But again, our approach is without steroid injections, without painkillers, and without surgery. Surgery would be the absolute last, furthest down the list resort for people that come into my clinic.
Got it. If I were you, Tim, I would pinch myself every morning, the people that you have saved from having surgery. I think it's just remarkable. We got a couple minutes left. Let me go to Lemsey. Would someone with bone cancer use shockwave therapy?
No, any active cancer would be considered contraindication, because what it's going to do is it's going to flood the air with blood flow. And when blood flows through tissue, it makes it grow. So if you have a tumor or cancer cells, it's going to have the potential to make it grow, if that makes sense. Like,
yes.
We wouldn't want to stimulate growth in an area where there could be cancer cells. So shockwave therapy is contraindicated for active cancer. Now, if a person's been cancer-free for a number of years, that kind of opens up the treatment protocols. But anything that's been in the last 5 years, we wouldn't recommend that. And of course, if we were in the conversation, then we would go straight to the oncologist, and we would get a letter from them, and not just to cover our butt, but to make sure that they're in agreement that it can't hurt. Now, if a person's at the end stage and they're wanting pain relief, then yeah, because their goal is not to reverse it at that point if it's at the very, very end stage. So when a person's at the end stage, their oncologist usually says, do whatever the heck you want, because it's not looking good with what we're doing. But if there's any viability, what the treatments are doing.
See the follow-up. What about the red light thing?
Red light's very similar in that it increases the mitochondrial communication. So the mitochondria is the center brain of each cell, and red light therapy stimulates that. And so it has the potential to really spark some growth. And so I would shy away from those two therapies with active cancer. We would also shy away from anything regenerative. So if we're going to put those cells that we spun out of a person back into them after they're concentrated, or if we're going to go with the day-old umbilical cord cells, then we would need you to be cancer-free for 5 years.
I don't know, Tim, maybe you know what this means. I see in the chat line, Tammy, is that PRP? I don't know if that
PRP
stands
is
for.
Yes, PRP stands for platelet-rich plasma, and that is one of the regenerative methods that we use. So there's two different where we draw it from you and spin it and put it back in that we do in this office, and that would be something called A2M, which stands for alpha-2 macroglobulin, and there's also PRP, which stands for platelet-rich plasma. It's taking different components, the A2M component or the platelet component, and concentrating them and putting them back in. And for neuropathy in particular, we can stop that inflammatory process with the A2M, and then we can rebuild nerves with the PRP. So it may be done in conjunction with one another. Great question.
And we've been running your phone number below, but we have so many people on iHeart and Spotify who are listening and on radio. Tell people how they can reach your office.
Oh, the number is there, but if they want to learn more about kind of the treatments that we do, we're very active online. You can go to trinityintegratedmedical.com. I'll put that in the chat for you guys. www.trinityintegratedmedical. And you can, if I spelled it right, make sure. Nope, I did not. trinityintegratedmedical.com. You can learn. That's our website.
Yes.
As well, we have a YouTube channel where a lot of these processes are explained. It's simply youtube.com/Dr. Tim Usselton, all spelled out, and actually just DR, not doctor. DRTIMUSELTON. That's on our YouTube channel. And, otherwise, we post on Facebook, Instagram, TikTok, LinkedIn. We're in all of the social media platforms where you could easily find us. If you just Google searched my name, it'd probably come up in 5-6 different places. But you can get all the information you need, and you can call our office too if you're in the area and you want to get in a consultation here in the clinic.
And we replay this show every week at 10 o'clock Eastern time on Tuesdays. We are so lucky to have Tim. Tim, thank you so much. Boy, you had a lot of fans today. We will see you again. Your show will replay again next week, and we'll see you live again next month.
All right. Thank you, Steve.
Thank you, Tim. We're going to go to break. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.